Hello, my name is Caroline Robb, and I'm a third-year diagnostic radiology resident at the Mallinckrodt Institute of Radiology at Barnes Jewish Hospital in St. Louis, Missouri. Here, I will briefly discuss the results of several years of research that was conducted in concert with the Department of Surgery at Washington University in St. Louis School of Medicine and Mid-America Transplant Services, a local organ procurement organization that works closely with our surgery and radiology departments. In 2010, Mid-America Transplant Services installed a CT scanner at its facility, which allowed for the opportunity to develop a systematic approach to screening eligible deceased donors. This study was conducted to retrospectively evaluate the impact of CT on the decision-making process and the procurement procedure. We analyzed the past medical history, CT reports, biopsy results, and operative findings from 373 patients who were eligible for donation after brain death and had a CT performed at the organ procurement organization. We concluded that CT has the potential to assist with the evaluation of multiple important factors involved in deceased donor liver evaluation in a way that significantly improves the process. CT can have a direct impact on the directive decision-making process as well as the procurement procedure itself. For example, in our patient cohort, liver volume measured on CT was a more significant factor in determining whether a liver was accepted for transplant than the patient's BMI. And when assessing how CT characterization of hepatic steatosis impacted the decision-making process, we found that the odds of a liver that did not have steatosis on CT being used for transplant was 4 times greater than using a liver with steatosis on CT. Additionally, when CT exams were performed with intravenous contrast, which allows radiologists to evaluate the hepatic vasculature, the intraoperative time from incision to cross-clamping the aorta was significantly decreased. Overall, we found that in our patient cohort, CT was just as important as biopsy results in the impact on the organ-directive decision-making process, with CT being cited as the most influential factor in the final decision in 29% of cases. CT accurately identified key factors that played statistically significant roles in the decision to transplant, including identification of cirrhosis and steatosis and characterizing hepatic arterial anatomy. In conclusion, using CT to evaluate livers in potential deceased organ donors can improve the efficiency and accuracy of the pre-transplant evaluation process by directly impacting the directive decision-making process and the procurement procedure.